probably all know Kat by now, and she's famous anyway within the HD community. She's been working with HD for many, many years in many different guises, working hard with the youth service, and then, you know, one of the founding members of the Huntington's Disease Youth Organisation, and Kat is also a family member, so she's got a lot of different experiences of working with HD, and now she works with for the second time for the Scottish Huntington's Association as Chief Operations
Something
Officer.
like that, yeah.
So we're really grateful that Kat is here today, and thank you for coming over.
Thank you, Patricia. So when I do any of these talks, I make it up as I go along. So feel free to shout at me. Anne's very good at shouting at me. She does it often. So if there's any questions, just fire them away, and it'll take us in a wee road that we don't know we're going to go on. But as Patricia said, so I'm an HD family member, first and foremost, but I have been involved with Scottish Huntington's before it was Scottish Huntington's, which is a long time ago. And I grew up with HD. And as part of growing up with HD, I was very lucky to have a mum and dad who believed wholeheartedly in talking about Huntington's and trying to reduce the stigma on it. So I grew up thinking everybody knew about it, which meant I could talk to anybody about it, and I've not shut up since. So this is my mum and my gran, both of whom had Huntington's, and me and my sister. So when my gran was diagnosed, I was born about 2 months later. And I like to tell people I'm from a mixed race family, because my dad was a Catholic and my mum was a Protestant. And my gran was raging that there was a Catholic coming into the family, but on my dad's side, she was raging that there was a Protestant coming into the family. But she was a good baker, so that was okay. I am now, as Patricia says, I've now gone back to work for Scottish Huntington's, and every few months they stick another couple of titles onto my job description. So at the minute I'm Head of Specialist Services and Income Generation, and I will explain what that is later on. I have worked within HD for about 28 years now, so I started when I was about 4. And one of my other roles is that I still chair the European Huntington's Disease Network Young Adult Working Group, because I have a big passion for working with children and young people. So that's a wee bit about me. Okay, so Patricia asked me to talk about helping ourselves. So the way, I know you are all looking at this going, what on earth is going on in these photographs? And I promise I will explain. So one of the big things that I learned very early is that you need to be your own expert, and a lot of the conversation with Niall today was about that, about talking to the politicians, educating your doctors, talking to anybody, but also doing really strange things that's going to attract people's attention to ask you, what's that in your t-shirt? Why are you doing this? So these are some of the mad things that I have done over the course of the years to become my own expert. So I jumped off the bridge at Ben Nevis. I terrified a whole bunch of Japanese tourists who thought I was trying to kill myself. I promise there's a big body of water underneath that, so it was a soft landing. They made me swim the whitewater rafting course. And to make it exciting, they gave me a poo floaty. I've done far too many runs and I hate running. And we've done a whole load of other things as well. We've played charity football matches in reverse roles. So the women were dressed as men and the men were dressed as women, and the men enjoyed it far too much. We've done dances and gala nights, and we've done clothes swaps and stuff like that. So we've been very inventive about it, and we've taken it to communities who have never heard of Huntington's disease and bored them rigid and sent them away as experts as well. And the other part of that is been talking to anybody who will listen who is within a health and social care sector. So talking to the social workers and sitting them down and saying, I know you're here to talk about my mum, But before you do that, you've got a wee lesson to go through, and there will be a test at the end of this. To the GPs and to the neurologists and the psychiatrists who didn't want to listen, we made them listen by becoming the expert in the room. I was the one that was contradicting. And in more times than I care to mention, they asked, "Oh, are you a doctor?" And I never said no. I'm not a doctor. But I never said no. What I said was, would it change what's happening in the room today if I was? And so they became, you get a very different conversation when they think you're a medic. It's really cool. But we had to be the experts in the room to get the care that we needed, because it didn't exist then. And we needed to make sure that what was going on was the right thing that was happening at the right time. So we became experts. So be your own experts, my first bit. You might recognise some faces in these. I tried to pull out some of my Irish photos. So one of the big things that I have probably worked the longest on in Huntington is breaking down barriers. And the biggest barrier that we had was children and young people. We faced this first in Scotland, where we said we need a youth service. And everybody went, absolutely not. You can't talk to children and young people about Huntington's, you'll terrify them. We don't want to talk about it as adults, so why do you want to talk about the kids? So we did it anyway. And then that kind of grew to young people advocating for themselves, and we developed a youth service, and we got some evidence for that. And then we took it to Europe, and we lobbied EHDN, first of all, and said, we need to do something with children and young people. Here's the evidence that we've gathered from Scotland. Here's the evidence that we've gathered from the US. This works. We know this works. What can we do here? And they said no, which is not unusual. So we got a slot on the World Congress bill, and we went and talked at the World Congress. And again, we kind of said, here's some scientific evidence about working with children and young people. Here's the results of some research that we got independent researchers to do. This works. And one of the scientists in the room said to me, you bring young people together who are impacted by Huntington's? Absolutely, yes. Don't they go on to have mutant Huntington's babies? To which I went, what kind of youth club did you go to? That sounds dead exciting, we just play games. So she then got an education on working with young people and was quite firmly slapped into place. But from that meeting, we got the opportunity to come together in Prague. And we brought young people from all over the world to Prague to talk to them. And from the Prague meeting, HDEO was born and HD Buzz was born. And it was the power of young people in that room that changed it. They broke their own barriers. They told their own story and said, we deserve advice and education as much as an adult does. It impacts us just as much. So what we're going to do about it. So they changed that for themselves. That led to us having European Youth Camp, and then to the first Irish Youth Camp that we did with HDANI and HDAI, which was good fun. And I got into a lot of trouble after that as well from some people here. But we had a great time, and one of the big things that came out of that was that the young people got the opportunity to meet other young people from all over Ireland, and then some of them went on to do some things in Europe as well, either as part of the Young Adult Working Group on the far corner, or with the European network to be able to kind of like change things again. And again, we got them all to, I think they ended up going to Stockholm with us as well, and it's great for your passport. But we got them all to Stockholm, and we ended up with, I think, 50 odd young people on the stage at Stockholm, where a group of about 600 scientists, academic, clinicians all stood up and applauded. They got a huge standing ovation for the work that they had done in such a short time, changing and breaking down those barriers. So that's some of the stuff that we've done for breaking down barriers. I always end up with really elegant pictures of me. So my second big passion is taking part in research. I am very lucky to be gene negative, but gene negative does not mean that I don't take part in things. It means that I'm more passionate about taking part in things. So this was my first lumbar puncture. I've now had 8. I'm an expert at it. I'm better than the anaesthesiologist at it. I've had, I think, 12 different MRIs. I've had some fancy spaceship type hairdryer thing that measures the magnetic electronic stuff that goes across your head. It was really weird, but we did that. I've donated so much blood. I've donated spinal fluid. I've donated swabs of my saliva because it doesn't cost me anything to take part in research, but I learn so much from taking part in research because I get to talk to the people who are doing it. We get to impassion them about doing research and staying in Huntington's as well, because a lot of the young researchers are doing it as part of their PhD, or they're part of a very time-limited insight into Huntington's. So we get them to the point where they don't want to leave as well. Or if they do leave, they go into clinical practice and then they tell others about Huntington's and they start spreading awareness and start doing it. For me, research is the key to, one, learning about Huntington's, but also solving the problems of Huntington's as well, whether that's a lack of service, a lack of support, a lack of education, a lack of treatments, not having the right types of treatments, or showing people how to do it right. All of it comes back to research, whether that's medical research, some of the observational research that we do, but also the things that Niall were talking about, filling in the surveys, taking part in the interviews, getting people to listen, and under those structured things we can prove different things. So it's an ongoing process for me. I've been very lucky to be accepted into so many research projects, and I've been really lucky to also be involved in delivering some of these research projects. We are just about to launch a whole bunch of research projects in Scotland. We're again really lucky, and part of that is that we're going to look at how we get treatments out to people when they're available. So we've already started those conversations with the Scottish Medicines Consortium, which is nice, but in Scotland, because we're petty and we can't do the same as anybody else. So we're starting those conversations just now, so as that when something becomes available, we're not running to catch up with ourselves to get information over to them. So research is important for me. I'll show this at the end. It's a video that we made last year called Who Do You Think You Are? And it's all talking about research, and there's some cool videos of me getting tortured. So let me do this. But what I wanted to also talk to you about is Scotland, because we helped ourselves. And all of the stuff that you talked about this morning, we did, but we started it back in 1989 when somebody told us we couldn't. And there was a group of families and 2 amazing female doctors who went, you need to get together and talk to one another and then go and talk to other people. And that's how Scottish Huntington's was born. So we were developed in 1989, and we started with somebody working 10 hours a week, and their job was to try and look at what services they could provide to to patients with Huntington's in Scotland on 10 hours a week. That's what we started with. Their job basically was go and find the people who have Huntington's. That was their job. That has grown to this service now over the last 36 years. It has grown to a team of 15 HD specialists across Scotland, a youth service that covers the whole of Scotland. So we cover 27 of the 32 local authority health board areas in Scotland. A financial wellbeing service that, depending on what day of the week it is, it's either fully staffed or not, because it's a really difficult service to staff at the minute. And then we have our central team who we could not do all of these jobs with. So that's our finance worker, our admin person who answers the phone and tells me what I've not done that day, to our chief exec and me, and also our communications lead. So we've got a really big team. There's about 46 of us now that are in Scotland who are dedicated to Huntington's. So we're really lucky. But The bit that works is that we work with the whole system. So you were talking earlier about the care framework or the care pathway. We were the first country in the world to have one. It was a 5-year project to develop. It is an ongoing project because as soon as you've written it, it's out of date because somebody moves on or something changes. So it's an ongoing project. And what we have to do is we need to keep up with things. So our HD clinical specialists do all of this and more, and basically anything else that's needed. I promise I will make Patricia share these with you so that you don't need to read it all. But we do clinical care, we manage the medicine stuff. We make sure that if somebody needs something, we're going to do it at home, and then we'll phone up the doctor and go, Margaret needs or Jimmy needs. How can we get this to work so that people don't need to wait for things and we can manage things before they get to crisis? That's the whole point of this service, is to stop us getting to crisis point. We don't want it. We don't want people going into acute hospitals. It happens, but we limit that by doing all of this stuff. The carer support side of it is vital. If we don't support the carers, the whole thing falls apart. So you were asking earlier about supporting carers and how do we do it and how do we keep them from having burnout and breakdowns and all of that. It's really difficult because she's a murder at listening to your own advice. Go have a cup of tea. I'm too busy. I've got this, and this to do. Go and have a cup of tea. Go to the toilet. I remember saying to somebody who told me, I don't have time for self-care. And I was like, see, when you go to the toilet, take an extra minute. Take an extra minute, pretend it's a big poo. Go to the toilet and just take an extra minute, and each time you go to the toilet, take another 30 seconds, take another bit, until you just have a room with a lock. It's really important to have a lock, that you can just take some time. And when you can get that into your routine of, I've just got time to take a breath, it becomes easier to prioritise yourself as a carer. Because if you break, the whole thing breaks. So we need to get used to priorities. So that's why the carer service is so important for us. Youth service, again, this is a passion project for me, so I love it. The whole point of this is that everything that we did was a bit age and stage appropriate. Really big fancy words was what was right for that young person at that point in time. And one of the things that we also talk about is that chronological age and their HD age are two different things, because you can have an 8-year-old and an 18-year-old who are at the exact same point in an HD journey because they've both just learned about it. So we treat things about where they're at, which is why that stage bit is really important. What information do they need, and what way do they need to learn that information? And most of the time, it comes from these group sessions about talking to other kids the same age as them, that have got the same interest, and then getting to talk to one another. But if you've got a kid in there who's full of nonsense and doesn't know what they're talking about, they're going to tell everybody else that same thing. So that's why we try and facilitate it, to make sure that they're getting the right thing. We also emphasise having fun and giving them the opportunity to be a kid again. So the residentials and the camps and the activity days don't focus solely on education. They focus on being a kid and going out and having a laugh and getting into bother half the time and staying up late when they're meant to be in their bed at 10 o'clock and talking to other people and sharing life with other young people. It's really important that they get that opportunity as well. Financial wellbeing service, oh my goodness. I don't know how we survived without this. And your lady in the room, I forgot her name, sorry. Sandra. Like, what you do is amazing. This whole thing is absolutely phenomenal, and the change that's made. So we've had our service now for, I think, 10 years. And when I did the statistics the other day there for a funding report, we've brought £7 million of extra income over that space and time into people's homes who have HD that they wouldn't have got, because they would have got rejected at their first application, because you tell the truth on benefits applications. These are too honest. Or you don't tell us the truth at all because you go, I'm fine. I'm absolutely fine. I don't need any help. Whilst your on your backside and can't make anything happen. But they've been phenomenal at changing that. But that was the figure that we came up with the other day there when I ran the reports, was £7 million of additional income into people's houses, whether that's through unlocking pensions, unlocking benefits, getting the right adaptations done under grants rather than loans. It's a huge amount of money over a 10-year period for the people that we work with. This is what we do. So we don't do this alone. We couldn't possibly do it alone. But the bit that makes it different is that we're the only person who's consistent in that family's life. So they might deal with all of these clinical teams and healthcare services and community services, and they'll change because it's like a revolving door in the minute of those services. But we stay the same. We carry their case the whole way through. We never shut a case, and we take it all the way through, and that's what makes the difference, because they don't need to keep telling their story. They don't need to keep going back over things. They get believed because they've got somebody on their side that says, I know you're not seeing this, but this is what's happening. So we need these symptoms managed because we've been in the house and we've seen it. I don't need to wait till you go to a clinic to see this. We can get people assessed quicker, but we can only do that because we've got this ability to pull everybody together really quickly. It's not perfect. And I know you're sitting here going, I want her to shut up because we want that and we can't get it. It's not perfect yet, but we keep building on it and we keep doing it because at the end of the day, families tell us what they need. And we're all part of that same community, whether we're a family member or whether we're a professional who works in this. Everybody within the organisation completely believes that they're fighting on the same side as the families that they work with. So we do coordinated care. I'll do this quickly. So we developed the National Care Framework. We were very lucky that the Scottish Government paid for it. So we lobbied the Scottish Government and said, there isn't one anywhere in the world. It helps when you've got a petty government who want to be something that nobody else has had. And they gave us funding to go and hire somebody to develop this, and we interviewed close to 600 family members and professionals across Scotland, every corner of Scotland. We interviewed them to see what they wanted, how it would work, what kind of services they needed, and then how those all joined up. We have a national care framework, and then we have the 9 regional care frameworks, which is the regional health boards. And we got all of them to sign up to it. So whenever they try and cut funding or change something, we have a framework where we go, you're not allowed. You said that, you signed it, I've got a signature. And at the minute, I think we're still the only country in the world that has one. But we don't tell anybody about it because we're rubbish at singing our praises, I think. But it is an amazing model, and I'm happy to share all of the work that we did with that with you, because I think it's really important that we try and roll this out. You can see it. It's live, it's on the website. You can go on and you can look up the national one, and you can look up all of the regional variations of it and who's the specialists and who's that, and it's all linked to the patient outcomes for Scotland as well, so that again, it's got policy and strategy behind it, so it's looking at it. Right, I'll shut up soon, I promise. Here are my 4 takeaways from getting involved and doing it for yourself. Get involved in anything that you're comfortable with. If it's having a conversation, if it's wearing a t-shirt, if it's wearing a wristband, if it's leaving stuff in a pub or a shop where there's information, or putting information in your local doctor's surgery, get involved. Get involved where you feel comfortable. If you're comfortable, then you'll be able to do it and you'll be able to feel good about it. Tell your story. Your story is the most valuable thing that you have. It's the bit that changes people's perception of things. It is the bit that opens doors. Tell your story. Whether that's to the person standing next to you in the bus stop, person next to you on an aeroplane. I do a lot of travelling, so a lot of stories are told on aeroplanes and trains and buses and things like that. But tell your story. I've met some amazing people in really weird places by talking about HD. My favourite thing in the world is to annoy a politician. I take great joy in annoying a politician and noising them up and finding out when they're wrong and then challenging them on it. My local politician, who we have just re-elected, almost cries when I appear at his surgery. And I love that. And if he ever retires, I think it'll be because I've done his head in enough. And I will consider that a win. But I genuinely annoy politicians on a daily basis. And I pick them up on things like your video that you just showed. Oh, you said actually in 1974 that you would do this and you've not done it yet, so why have you not done it yet? I annoy the life out of politicians. Please do it. That's what they're paid for. That's what they're getting the money for. That's their job, is to listen to you and to take something forward. And what's really good about annoying them is they've got to reply to you. They've got to respond. So please do it, because if they've got to write a letter, it's now a public record that somebody spoke to them about Huntington's disease and they need to do something about it, whether that's write to somebody else or to bring it up with the minister or to bring it up with the HSC. They've got to respond to that. So annoy politicians and always, always, always be the expert in the room. You're the person who lives with Huntington's 24 hours a day. You know more about Huntington's than anybody else in the room, because each one of us have a different experience of Huntington's. Each one of us have a different understanding of Huntington's, and every person with Huntington's has a different set of symptoms to the other person. So be the expert in the room. Advocating for yourself, advocating for others, you're the expert. Whether that's sitting in a HD clinic, talking to Niall, you're still the expert. And Niall would not mind me saying that, because he would agree with me. When the person comes into clinic with us, they're the expert in the room. They tell us what's going on. When they lie to us, we pick them up at it and go, sure about that? Are you really sure that what you should be doing is cleaning your windows at a 6-foot ladder when you're in a wheelchair? True story, genuinely a true story. We went in and their husband phoned me up and went, can you tell her to stop cleaning the windows? I was like, what do you mean she's cleaning the windows? Oh, the neighbour found her on a ladder, it was 6 foot high, and she was about halfway up it trying to clean the window. No idea how she managed it, but that's the kind of stuff that we do. But the expert in the room that day was, well, I think I can still clean a window, so why can I not clean a window? Well, maybe no date for the ladder, but here's an extendable pole then if you want to clean the windows. That's me. Any questions?
I'm sure you're being polite there when you say annoy the life out of a politician.
I know, I'm not being well. It's probably the polite version of it, but yeah, I'm pretty sure there's a file somewhere in an MSP's drawer that goes, see if she contacts me, just ignore her. I can't take any more of her. I'm sure there's a swear word in between my first and second name when it comes up. I'm all right with that. I'm quite proud of that. I like the fact that I annoy them. But we get stuff done because we annoy them. And we write to them on a daily basis. Just write to that MP and see what they're going to do. That MSP's not responded, let's do it. I annoy politicians for a living. That's pretty much my job these days, is to annoy politicians. If I'm not annoying politicians, I'm annoying fundraisers. That's my job just now, is to do that, because it's the only way that you get things to change. Because if we've got one politician that's on your side, you're more likely to get other politicians on their side, because you bug them until they bug another politician, until they bug another politician, and all of a sudden you've got 5 people who now want to do a parliamentary reception or to want to get a working group together to change something, because there's a few of them now getting bugged rather than one. So it's the only way that we get change. That's the only way that we found that we could get anything done, is to annoy them. And you've got an amazing growing community here, in researchers and clinicians who want to get involved, who know the true stories, and they're willing to help you. But as Niall had said earlier, they don't get listened to, but you do. But to get listened to, you need to shout, and you need to scream, and you need to stamp your feet, and you need to pretend you're 2 and having a tantrum. And then once you've got their attention, you can sit down and calmly tell them what they're doing wrong and what you need them to do next.
We should all move to Scotland right now.
Yeah, I second that. Yeah.
Don't. The Reform group have just got seats and I'm really upset about that. We'll get rid of them, don't worry. Because we'll annoy them as well. Tell them why they're wrong. But it's a really good model, but it's a model that's took time in a community to build. This didn't happen overnight. This took us 36 years to get to where we are today. We had one service for about 5 years that only had a part-time worker till we gathered the evidence to get a second service. And then it started really quickly growing from there. And then we went, we need kids involved, so how do we do that? We did a pilot project, we built the evidence, we built the data, and we proved that this was going to work and it was going to save them money if we did this. And then financial wellbeing stuff came in from the same thing. We built a body of evidence that said that people with Huntington's were really struggling to access benefits, to be understood, to access mainstream benefit systems as well. Let's try it, let's see where we can go. The framework came out of, there isn't one in the world. Wouldn't you like to be the first? You could be a world first on this. It was genuinely sweet talking their petty nature to get them to do this. You know, use every angle and weakness that they have to get that leverage in there. There will be a very different story in terms of the funding and the proposal that went in, of course, that it was not on their pettiness that got it, but that's what we did. We just worked on what they needed at that point in time, and we were like, you could be the first in the world to do this.
Kath, you said start writing to all your politicians in your area, and you said, is this true, Patricia, that there will be kind of a framework letter done up?
Yeah, we're going to do a template, yeah.
In that letter, can we refer them to the Scottish model and say this model is already?
Well, I think we have been telling politicians a lot
Yeah,
about
but if all
trying to
the
compare,
family
yeah,
members,
yeah.
like if it's coming in every single letter,
Yeah.
like you don't have to make a framework, there's one already there.
Yeah.
Yeah,
The
we can
first
pull
and
out
only
some,
in the world.
absolutely, and we can pull out some statistics like you've got 15 specialist workers and
Yeah.
10 clinics or something.
Yeah,
You know, so we can use those comparisons
yeah,
to,
absolutely. Same, we're very similar populations, so
Yeah.
use the data that we've managed to gather as your baseline for it. And when you're writing to politicians, use the framework letter, but put your story in it. This is how Huntington's impacts me and my family. That's really important because that's what differentiates the letters, but what they'll find is common themes on this. And the common theme is, as a politician, you are feeling me and my family. And don't be afraid to use that language as well, just tell them.
When we met Jennifer Carroll McNeil, she exactly told us that she wasn't going to be following the Scottish one. She wasn't going to be handing out money for particular things, she said.
Condition
She was going to be
specific.
handing it out like that.
Yeah.
Exactly told us that when we met her there 6 months ago.
Yeah.
Remember?
That's okay. What you've now got is where her stand is, and then you go, here's why you're wrong. And here's the data that proves you're wrong. So the generic model for that would include Huntington's, we have evidence from a few different countries that it doesn't work. That it will cost health services more very quickly, that it will cause waiting lists to go up at general practitioners, it will cause kerfuffle at your accident and emergency departments because you'll end up with more people trying to access services there. You will end up with social care not able to cope. There is evidence for that. So you know, use everything that they say no to as your basis for what you're going to gather to prove them wrong. So I'd spoke to Patricia yesterday, and we've been doing a piece of work on neurological and rare conditions and the cost to society that is if it's not done correctly, and why there is a need for specialist services. So I'll share all that evidence with Patricia, but it's all taking what they say and go, right, okay, how do I hit you back with your own words to prove you're wrong? And that's all the time they do it with us. They say no, and I go, right, okay, How do I get you to say yes? What do I need to prove to you that you're wrong on this? Because we've done the research, we've done the conversations, we've lived the life, we've lived the experience. Somebody once told me, when you're dealing with politicians or industry, quantify your tears, put it in pounds and pence or euros and cents. Tell them how much money it's going to cost them, tell them how much money it's going to save them, tell them how much money it's going to make them, depending who you're aiming it at. That's how you sell your tears to them. You need to sell it in the money that it's going to cost them, save them, or make them. And that's what we've done. That's how we've done it. Because I can prove to them that I reduce the amount of people who are going to acute hospital beds. I can prove to them that I can keep people at home longer with better care packages that cost them much less money. I can prove to them that if I support carers, carers are less likely to burn out and get into crisis. I can prove that we can keep people well longer if you put the right support services in. I can prove that we can keep people from going into mental health crisis if we manage their symptoms and medication timely. And I can do that because I gather the evidence every single time. My staff hate me for it because they've got to tick lots of boxes and they've got to put lots of things into a database so that I can go to politicians and go, here's why you're wrong. It takes time to gather it, but use it in a position where you can use other countries' data to support what you need. Because it doesn't need to be just Irish data, it can be European data, it can be Scottish data, it can be English and Welsh data, it could be data from the Netherlands. We can use anybody's data because we can match on the demographics and the social economic makeup of countries to kind of say this is why we're the same. Because Huntington's is the same when it comes to what we need. We need the right specialist support, we need the right specialist treatments, and we need to have a pathway that when something happens, whether that's a change in research or a clinical trial coming or a medicine being available, we can react to it. And it all comes down to having the right network in place. And to do that, we need to challenge those that say no and never take no for an answer. So that's where annoying politicians come into it. So even if they say no, okay, I'll be back in 6 weeks with another proposal for you. Be prepared. I won't accept the same answer, but that's I've never took no for an answer. A police officer said to me once, you seem to follow the model of proceed until apprehended. And I said, yes, it's why I run. Because nobody's apprehended me yet. It's just what we've got to do. I don't stop until we have the services in place for people with Huntington's all over the world. As much as I work and live in Scotland, I have had the pleasure of working across the world with people impacted by Huntington's. And it is amazing what some people put up with, the resilience that they have. But at the end of the day, they're people who are impacted by the same thing that my family were. So if I can change one thing for them, it helps my family, which is why the 8 lumbar punctures, the multiple MRIs, the blood draws. Actually, a blood draw is worse than an MRI, lumbar puncture for me because they can never get blood out of me. But I'll do it. You can have what you like. It's only fluids. I'll replenish them in a couple of hours. Have them. It's also dead interesting as well, scaring doctors when they're taking blood out of you and they can't get it. Jaggy. Oh, what do you mean you felt that? I'm only kidding, I didn't. It's fine. But it's what we do. Anything else?
Kath, that was amazing. You presented a very complex problem into very easy solutions.
Well, see, when you're daft, Anne, you need to take complex things and present them simply because it's the only way I understand them.
You see, very often for families that are overwhelmed,
Yeah.
it's amounted too big to climb.
Yeah.
But when you've explained it down into very simple terms, sit down, write your letter, that's something we can all do.
Yeah.
You know, it really is something we can all do.
Yeah. How do you eat an elephant one bite at a time?
In the next couple of months, there'll be politicians all over Ireland who are going to be hounded.
Excellent.
Yeah.
And it doesn't need to come from your family. You can also go to your pals and go, get this template letter, go and sign it and send it in. And just make it, their story is, my friend lives with this and I see the struggle that they've got every day. That's the line. That goes in. So it doesn't just need to be used that send this. Get your advocates, get the people that you're sitting down having a cup of tea with who aren't impacted directly, but they're indirectly impacted because they're in your life and they see the impact that it has on you. So get them to write the letter. You write it for them and they sign it.
See, that's a simple, I never would have thought of it. I never would have thought of it. So that's what I say, thank you, Kat. You've really made something very complex and kind of out of reach. I can't wait to go home now and get these names and get their addresses and get ready for the letter.
Yeah.
So, thank you.
You're very welcome. And you don't need to swim whitewater rapids with a poo. You can just write a letter. Swimming with a poo is optional. It's great fun, but it's optional. All these things are optional, but doing something, whether that's just talking to somebody next to you about it or writing your letters, sharing your story, it all opens doors one way or another.
Well, I'll talk to anyone.
Would you, Anne? You're that shy and retiring though.
I'll talk to
Oh.
anyone, you know. And my kids are very open about it as well.
Yeah.
They talk to people about it,
Yeah,
you know, because we made it normal conversation from when they were very small.
absolutely.
But then their dad was,
We need them on TV.
well, Sean's been on TV. You know that series, The Gone? Did anyone watch that series?
Yeah.
You know the little clip at the end where your woman is researching HD? That's my son Sean that's talking.
Yeah.
We need Charlie Bird. Yeah. Unfortunately, he's gone. We'll do a seance.
Well, you know,
Whatever works.
yeah.
Well, I think Kat has proved that, you know, every little thing helps.
Yeah.
And it all contributes to the bigger picture. So it's to feel comfortable with doing what you can do.
Yeah.
And, you know, nobody wants to put any pressure on anybody and not everybody has to go on TV, but we're lucky we have some advocates who can do that as well and go on radio and stuff. And Bernie isn't here, but I know she's done her share going on radio and all of that. So, but we can also all talk to politicians and healthcare professionals and the GP or whatever, you know, to just get the message out there.
Yeah. This picture here at the very end, I was doing a radio interview at the same time. So I'm on the phone, right? No, but I need to tell you why. Because what happened was, this happened the day that Roche announced the start of their clinical trial. So this was the launch of Tom Merson. And I had double booked myself to both be on radio and to have this done, so I just did it at the same time. So this poor neurologist is having to be super quiet, putting a needle into my back because we're live on Radio Scotland. So that was fun. Yeah, so that was pressure for her. It wasn't pressure for me, I was just on the radio, but she was having to do this quietly, trying to react to, had she hit the right spot and paralysed me? She couldn't, it's the wrong bit. It's not, you're nowhere near your spinal cord, it's fine, look how far down your back you are. But yeah, so she was doing that while I was on the radio and she was just like, you're not right in the head. And I was like, that's okay, you're a neurologist, not a psychiatrist, we'll not look into this further. But that was that day, that's the story behind that one, that's why it's cropped the way it's cropped, because I'm on the phone. Yeah.
Well,
thank you, everybody.
can we all just give a big round of applause? Thank you for all you do.
Anytime. Thank you.